Okay, so here we have Rick Selvage. And so, Rick, how did you first come to hear about our office?
I was getting my phone changed, and I ran into Dr. Paul in there, and he was talking to somebody, and I just walked up and told him, I said, you know, I've had the numbness in the front of my left leg for 30 years, and it's getting worse and worse and worse. And then my lower back was so bad I could hardly get off the floor because I'd get this little catch or something whenever I twist. So I broke down, and I thought, I'm going to give it a try. What do I got to lose? And that's basically why I came.
Okay, great. So with the back, how severe was it? I mean,
it was so bad I didn't know if I could get off the floor a couple times. I mean, it was really bad. I mean, it's just like a knife was in my back. And then, like I said, I had the numbness in my top of my leg so bad that if I went anywhere, I had to keep my feet shuffling around because my knee would go so, leg and knee would go so numb up there that I couldn't even feel it. I mean, it was just unbelievable. It was so numb. And
okay.
It was a lot of pain.
All right, and so with this condition, you know, in the past, did you go see another chiropractor, another doctor, and what were the results there?
Oh geez, at least 15 years ago, if not longer, somebody recommended, oh, this guy will really help you. So I went for, I don't know, I went once a week for 2-3 months, and it was a great back massage, but it didn't fix anything. And I just gave up and moved on. I just thought, well, that's fine. There's nothing you can do about it.
Okay. So since you've been here, Rick, and doing the rehab, the decompression, getting adjusted, what have been your results here at Dynamic Chiropractic and Rehab?
Well, now, I think it's pretty good. I mean, I'm 56. I've been in construction since I was 18. I beat my body up big time. And I know I deserve some of my aches and pains, but considering I stood in line the other day for over a half hour and didn't have, my wife kept trying to give me a chair because she knew I couldn't stand that long. I said, no, it's gotten a lot better. I said, I may not be perfect, but I'm definitely very comfortable compared to where I used to be. And my back, I said, I can now do construction work, get down on my hands and knees and crawl around. I'm 56, like I said, and I'm moving around with the young boys a little bit, stuff. Okay. So I'm impressed that I can actually get down there and bend and twist like they can. So, okay. Yeah.
So what would you tell another family member, neighbor, maybe going through some similar things like you've been going through?
Well, I would tell them it wouldn't hurt to try. I mean, you know, I've heard a lot of stories one way or another. My wife was very skeptical, being a nurse. And I thought, hey, what is it going to hurt? I'll give it a whirl. And I'm not perfect, but man, I feel a heck of a lot better than I used to, you know.
Okay. Okay, great. Rick, I appreciate it so much.